resident education is the beginning. It's the foundation that enables a podiatric practitioner to develop his skills. And that's why it's a 3-year program. To come out having the skills to be a foot and ankle reconstructive surgeon takes time. And you build upon that as you enter private practice. I've always been a proponent of the education in residents as well as practitioners. Education does not stop when you finish your residency. It continues forward, and that's why we have established at Present all the meetings that we put on, which are the resident meetings, the Superbones meeting, Desert Foot meeting. We are disseminating information across the country, state of the art, the best speakers we can obtain to allow people to stay up to skills and stay state of the art of where they should be in practice every day.
My name is Mark Trezia. I'm the chief resident at Coney Island Hospital, and I am originally from Glendale, California. I was able to go to all the workshops. They were all set up great. Gives us an opportunity to learn about new products. Gives us an opportunity to actually review, and if you've forgotten about certain products. And this year, actually, we learned even changes that are made to the products for the companies, which is a big thing for us because there's physicians and surgeons that are practicing, and if they're using something continuously and certain things are tweaked, then I'm assuming it's for the better because that was done by the company. So by learning from them, it's something that we can reflect on our own practices.
This is Wen Jae Sung back again with Present, and I'm here with the man on the street, and we're going to talk about what they think about the conference so far. So, what's your name?
Steven, Juliana.
Well, welcome, Steven. And you've been someone who's been to Present many times before. How many conferences have you come to so far?
This is my 5th year attending.
And you still keep coming back?
Yes, it's great. Great speakers, great lecturers. Yeah, really enjoy it. Good information.
So you're a 4th year attending now. Obviously, you attended when you were a resident. What did you think about the educational aspect of this conference?
I think it was good. I mean, we have a lot of good topics. We're looking forward to tomorrow, the radiology topics that they're going to be speaking about. Really good vendors here. I enjoy it.
Now, do you think this helped your boards any? Because that's always like a big question. Will this add to my boards? Will it actually help my board knowledge?
Yeah, I mean, I think that it really reviews some of the fundamentals that they go through, some of the basic sciences. I do think it helped. Coming especially here as a resident.
Hi, my name is Emma, and I'm a student at NYCPM. I'm a 3rd year student.
So Emma, what do you think about the conference so far?
Oh my God, the conference is so fun. It's my 2nd year. I come with my friend. I have a broad array of interests. I also study public health, so I really want something that incorporates public health as well as podiatry, and my goal is to try to combine the 2 degrees to give better patient care.
Do you feel like residency education, especially from Present, has benefited you in your residency?
Absolutely, it has. It's expanded on kind of what we touch on in the hospital and gives us a better understanding of products we're using and that we're not quite so accustomed to using as first years, and get more comfortable with using here at workshops and hands on these products, and also hearing about how they work and what patients benefit from them.
What's your opinion about with wound care? Would it be a good biologic for different wounds?
So I've seen a lot of benefits with using the amnions with patients. They seem to do very well with it. We've even applied them with our wound closures, and we see that there's a decrease in dehiscence and just better off wound healing for the patient's benefit.
I'm Dr. Mark Bernard, and I'm the Executive Director of the American Board of Podiatric Medicine. We came onto these conferences initially as a vendor, as with any other vendor, and I saw the potential several years ago of creating an affiliation with Present conferences, in particular with respect to the conferences that are resident-oriented, as is this one, and there's a like conference in the Chicago area. And with that vision, in discussion with Michael and with Alan, the owners of Present, through our affiliation, we now provide the questions that go into the Residency Rumble, which is conducted as part of both of the residency education summits, East and West.
Well, the residents are the future. And so it's very important that we bring our technologies to the students, because They're the doctors of tomorrow. And so it's very important for us to meet everybody. When we go to Desert Foot, we're looking at primarily large VA populace, and here it's residents. So we like to touch base with everybody.
Hi, my name is Emma, and I'm a third-year student at NYCPM, and today we are at the Residency Summit here in New Jersey, hosted by Present. And here I have a colleague as well, and I'm going to let him introduce himself.
I'm Cody Anderson. I'm a second-year resident at Southwestern Vermont Medical Center, and this is my second year here at this summit.
Okay. Hey, Cody, can you just let us know what do you think about the conference this year?
So far, it's good. Like I said, this is my second time here, and always learning new things, always meeting new people, always a good experience. I think it's good for all people, whether you're a resident or a student, to come and kind of check it out, because you're always going to find something maybe you didn't know before. Yeah, the workshops are actually probably my favorite part about the conference for me as a resident, just because you get some hands-on experience working with different materials. So maybe some of the things you might not get to do every day as a student even, you're kind of able to do here. And if you screw up, it's okay, because it's not a real person. So yeah, it's a really good experience.
And how do you think attending the workshops at this conference every year has influenced your practice as a resident at your program?
Again, I think it helps a lot. Just anytime you're able to get any sort of practice in is going to help have more confidence when you're going to actually do it on a real person. Because some of the materials that we use here, even some of the graphs, I've been able to use in practice. So it's been good. It's been helpful.
All right, we're finishing up Residency Summit East 2018 from Teaneck, New Jersey. And next year, we'll be right back here, August 9th through 11th, with an exciting new program, new curriculum. And we're looking forward to seeing everybody join us in Teaneck.